Hello and welcome to our special series on women at work. Now, India has had considerable success in the past in getting women to work. Unfortunately, some of that has got undone because of a variety of reasons. Now, the more important question is, in the post-COVID or COVID-19 world, where does this leave us? Does this in some ways give us an opportunity to redesign, relook at policies which bring women back to work and then thus restore some amount of balance in society? And more importantly, how can policymakers, including those in academia, media, bring about greater focus on this issue and, like I said, use this opportunity to drive greater emphasis? Now, can stories of women at work be one driver of positive change? And that's really the question we are asking. The question, I'm going to put this question to Soumya Kapoor Mehta. She is the head of IWWAGE in India, or the Initiative for What Works to Advance Women and Girls in the Economy, which focuses, among other things, on shifting evidence from how to what works. And that's, as you know, the most critical thing perhaps that we should be looking at today. Soumya, thank you very much for joining us. You've been doing a whole bunch of studies on women at work in multiple environments, including rural as well as urban. You've also looked at COVID-19 specifically. So tell us about what you've been seeing in recent months and what's changed, if anything.
Thanks, Govind. Thanks, firstly, for having me over. I think the media is full of stories about the negative impact that COVID has had, particularly on women. Firstly, you hear stories that, of course, the female labor force participation rates in India were always very low and had been declining over time, which was a source of worry. So we've been hearing that, after the last number that we had, about 27% women who are in the labor force, now it seems that we will be down to 20%. It's also because the sectors where women tend to be employed more, like services, food and health and travel, etc., hospitality, those seem to have been really adversely affected. So that's one aspect. But I think the other thing that's also being widely discussed and something that our organization's also been researching on is the added burdens that women have faced because you're working from home. Even for women who were, it's new to us setting, but many of the rural women would always be doing that you are added burdens of domestic chores, also looking after children, looking after the elderly now because they're not stepping out, providing for their care. So the unpaid care work burden, which now the time use is out from last year, and clearly it's very high for women compared to men. It's about 94% women tend to be engaged in unpaid care work in India, which is significantly high compared to other countries. It would have hit the roof, to say the least. I think the third thing that we are seeing is what everybody calls the shadow pandemic of violence, because women seem to be in their house. They are under a lot of mental stress and anxiety because they are managing a lot of things. But also you tend to be in close contact with your perpetrators because a lot of the violence that women face is often, at the hands of their family. But as feminist economists, we knew that this always existed. It's much more in the limelight now because women are not stepping out of their houses.
Right. And when you said that we are at 94% compared to other countries and that number is high, why is that?
I think it's also a lot to do with cultural norms, Govind. It's if you look at world values surveys and other surveys which try to do cross-country comparisons, if you were to even ask women that if there was a crisis of jobs in the economy, should it go to a man or should it go to a woman? And more women actually in India say it should go to a man. So it's always the man being the breadwinner. And so, of course, you have a crisis like COVID, and there is a job loss, particularly now where agriculture is also facing crises. There's high mechanization as well, which we've been observing as a trend. So more women actually tend to get displaced from these jobs because they were the ones who were doing the tilling, etc. So clearly, there has been, that right. Availability of opportunities is also low. And there is, of course, that cultural social norm that it's really the woman who has to take care of these domestic responsibilities.
Right. So as we talk about bringing more women into work or back into work, what are the priorities that we should be listing out from your vantage point?
I think the first is there's been a lot of, things that are being written around unpaid care work. in India, for example, in urban areas, and I was on another webinar with a few MPs, and they actually did not recognize the fact that in urban areas you don't even have that creche facility. In rural areas, in whatever state, there are Anganwadis that are available where you can leave your children. Here, I have no option. There, I don't know whether it's safe or not. I don't know what the quality of the creches is like. So how do, and you tend to live in nuclear families, unlike in rural areas. So where do you leave your children? So I think the whole burden of unpaid care needs to be addressed. I know that Niti Aayog has also been trying to think through policies on what can be done. So I think that's point number one. I think point number two is also to think about to do a reversal on what are the kind of opportunities or work kind of profiles that would suit women. Ideally, women would like to work to somewhere closer to home, somewhere which is why they tend to go into farming because it's just next to their house, the farms. But that has been declining. So, what are the opportunities that you can create for them in urban areas, which would be suitable, which they can do from their homes, but then they need all the accompanying sort of skills and digital sort of inclusion,
Right.
also financial schemes that can be reached out to them. So I think that as well, on what are the kind of opportunities which would be suitable for women to provide
Right.
that.
Right, and you did a study recently which also talked about the gig economy and the gig economy in the context of women workers. Now, does that offer opportunities, or does that mean in some ways that the space for women coming into work, or particularly into the digital economy, because of all the other reasons you pointed out earlier, has actually shrunk?
I would say that that is actually an opportunity that women are eagerly seeking, the gig economy, because they just feel it gives them the flexibility. So if I'm the beauty and wellness segment, instead of being stuck in a job in a salon, say for 9 to 7, I can just pick up 2 or 3 jobs with urban companies. So I think it gives them the flexibility to manage their time and again also attend to the home. It also gives them good earnings. But there are, in the report, we found that there are issues. For example, the gig, the platforms don't recognize them in the traditional sense of workers under labor laws. Now, of course, fortunately, the government has come out with this new social security code where the gig platform workers would be given some sort of,
Right.
compensation with the gig company. I mean, sorry, the platform people setting aside, the company setting aside some amount from their turnover. So let's see how that helps us. But it is something that actually women particularly like to explore, but cite issues of social security benefits and protections, which is lacking in the gig platform space.
Right. So let me go back to the point you made earlier about proximity to work, and that being an important aspect, linked, of course, to childcare where applicable. Now, what could be a policy intervention? And I'm assuming it's more state, or is it federal, or how does it come together?
Well, I think in many other countries, many innovations have been tried, Govind. For example, in Kenya, there are models where the private sector actually comes in, as well as the government. So there are PPP models that are set up, and what they do is they train women in urban slums to become, they call them mamapreneurs. So mummies are trained on how they can run a creche, but at the same time, the PPP platform ensures that there's adequate quality, it's affordable, they have learning materials, etc. So the woman also tends to get an income, and you have increased and solved the creche problem as well. So I think there are models internationally that one can draw from.
And how would be what would be the nature of intervention? So let's say we are in some ways back to square one or close to square one. So what could be the nature of intervention in? So one of the things, let's say, could be to have state-wise policies which say that, okay, location of industries could, or relocation of industries could be incentivized. Uh, could they be similar, or could there be other such moves?
Well, relocation of industries is one, but it's also, I mean, currently we also have a system where there has been some concern expressed on the revisions in the labor codes, and that is working. I mean, a lot of feminist economists have expressed concern that it is working to the detriment of workers. So yes, you can bring a factory close to them, but at the same time you need to ensure that all of these benefits are not diluted, and then the manufacturing companies, if they are under the purview of these labor laws. So currently COVID is a unusual situation where they have been given a free hand. So even
Right.
benefits like the Maternity Benefits Act, where you get 26 weeks off, you don't know whether a company who's hiring a woman would insure. So I think it's a both of compliance issue as well as bringing these opportunities home. I think it's also, an issue of skills. So traditionally, you tend to also train women in skills, where it's already ordained that they will be in those occupations, whether they are teachers or nurses or in the beauty and wellness segment. And I think even women are conditioned to believing that this is what we can do. So I think there needs to be some norm shifts around what women can do. And we also are doing an evaluation of the skills programs to see. And what we are actually finding is quite interesting, that you need to also have the support infrastructure for girls to actually come and study in these skilling centers in the ITIs, because you need hostels for them. Where would they stay? The parents will be concerned about issues of safety. And then you actually, manufacturing sector also starts looking at them as suitable prospects. So it's both a case of the demand side issue from the manufacturing sector side. Am I getting trained women who are engineers and electricians? But at the same time, I'm providing opportunities closer to their home, or transport that they can use, or even, the kind of environment that I can offer to them: equal pay, safe working conditions, ability to work at night, maternity benefits. So then all of those compliance issues also need to be met to be
Right.
able to incentivize a woman to come and work.
Right, and I'm going to ask you to take a step back to look at this challenge from a larger perspective. But before I do that, there are also lots of stories of inspiration, of courage, or which would motivate others. What comes to mind?
Well, we've been working a lot with two groups who have been doing fantastic work. One is we have an extensive program with the NRLM, National Rural Livelihoods Mission, where we are seeing these self-help groups of village women, rural women who are rising up to the challenge. So India actually never faced a shortage of sanitizers or masks courtesy these women. I mean, they shifted their skills very quickly, and they were able to manufacture these things en masse in a way. They've also been leading the charge in terms of providing, food at quarantine facilities for migrants, even running IEC campaigns on social distancing. So these self-help groups have actually served as the barefoot soldiers for the government. And I think the government is also realizing that here's a mass of women who can be tapped for multiple purposes and whose potential can be built upon. I think the other group is really the frontline workers. Everybody's been talking about them across the world. And we also have a project where we are evaluating the conditions under which they work. There have been stories about, of course, poor pay or pay not reaching them on time, also lack of protective gear and equipment. But at the same time, what we seem to be finding is that a lot of these workers are not even fully employed. I mean, ASHA workers only work on the basis of an incentive. And for them to actually then put their lives at risk without protective gear, sometimes not even enough pay, and actually go and take and run these tests, it just speaks to the incredible spirit that they have.
Right, and that's great to hear. So let me the last question. If you were to take that step back, what is the one thing or one or two things perhaps that we could do to bring about a transformation in thinking, which in turn would help address some of this, whether it's at a policy level, whether it's at a physical infrastructure level, and whether it's attitudes right inside homes, which we perhaps cannot penetrate sometimes?
Well, at a policy level, I think, like for example, we have been thinking about the budgetary provisions that can be made in certain schemes. Also, if you look at, there are provisions for women in public employment. If you look at the breakup of women in regular salary jobs in India, a lot of them actually prefer public to private employment because it gives them that security. But then you break up the public employment even further, you realize that there are a huge number of vacancies, even for Anganwadi workers and Asha workers, even for like in the police, there's supposed to be 33% women. You don't find them there. So, can we just take a step of even trying to fill these vacancies, which will also have a demand side effect on the economy because you're providing those jobs? So, that's on the policy side. I think, working through these groups of women has made us realize that there is a lot of work to be done with men as well who are actually willing to listen. I mean, and that's what our experience has been with these self-help groups of women or even running programs with Seva, that gradually they open up. And we have programs on gender trainings. When you actually do these programs with both men and then groups of women, they are willing to actually shift cultural norms. They see the economic benefits of joining a group, or joining, say, an organization like Seva, and then they open up. So there can be gradual shifts brought about through gender trainings. I think the third is probably platforms and accessibility to women. So a woman who's in a rural area, you don't expect her to pick up the phone and call a national helpline for counseling if she's facing a domestic violence issue. You need to build the leadership at the lower level, or give platforms like a gender resource center, a help desk that she can access willingly, rather than just go and stand in a panchayat office. We are trying to pilot those solutions as well. And then also probably, if nothing works, provide her with digital access. Like, why can't she get IVRS messages? Why can't she, just have an app on which you can see what are the schemes that I can apply for, upload the documents. And we're trying to do that with Hak Darshak, and we are finding great success because women seem to say, okay, I don't need to go through my husband or any government functionary. I can just do it through an SHG leader who's brought the app to me, and I can just download and apply for a scheme. So I think accessibility, last mile delivery becomes much more important for women as well.
Right. Soumya, that's a very useful and practical and important note to end on. Thank you so much for joining me and sharing your thoughts and insights.
Thanks so much, Govind.